Welcome to our one more session of YouTube and Instagram Live. I hope everybody has joined in so that we could start directly with the question answer session. Now, two or three things which are very important in last time, which I forgot to tell you. Make sure that whenever you are taking a case of fever, especially a case of nowadays there are a lot of viral fevers, dengue is there. In these type of fevers, remember one thing: don't always go by the how much is the temperature and how the temperature came by eating outside food. Most of the cases you will find that eating outside food, eating those type of food has caused diarrhea, dysentery and fever. I'll just share one very interesting case which I cured. Let me share a case of fever where the patient had fever. The patient had fever. Fever was about 101. There was a lot of weakness. So much so weakness that the patient could not walk. So much so that the patient was so weak, he used to walk and lie down in the bed and go to sleep. It was there for 24 hours and the patient had a lot of perspiration with pain in the head and pain in the body, especially legs. Now, a classical picture, if you see, a classical picture of Euphorbia perfluatum comes to our mind. Euphorbia perfluatum was given with no result. The patient called me and the patient said that, sir, the fever is now going 102 point, I think to 102 point something. And he said that everybody is telling me that to start an antibiotic. I said, just call for the antibiotic, don't take it, I'll give you one dose and then we'll see after 3 or 4 hours how does the medicine work. Again, the patient complained, I asked again the symptom and the patient said that though she was having fever, she was doing work, in spite of weakness, in spite of being sleepy, she used to do some work, again come back and lie down. I changed the remedy. I gave the patient 1 dose of China Ars 1M. 1 dose of China Ars 1M. After 1 hour, I got the call from her place and the patient told, can I go to the office of my husband because the staff is not there, so can I go to the office? So in 1 hour after the application, after giving China Ars, the whole fever subsided, the weakness went, the patient started eating, and the patient started the office the same day. I say same day, the same hour. So this is the interpretation which you must understand of the remedy, and that is the only difference between a partial simillimum and actual simillimum. So everybody remember China Ars. I must have told you China Ars before also, but in China Ars there are few symptoms which are very very important that everybody must remember. Otherwise, we give arsenic, we give China, we give Euphorbia perfluatum. The symptoms are better, but they are not cured. I hope everybody is listening to the YouTube and Instagram live. I have not got any likes or not got any thumbs up, or nobody is I can see online. There are a lot of people, but I cannot see. Nobody has wished me also today. Good afternoon. I hope everybody is understanding. I hope you can hear it properly. I'll ask my assistants. Is it okay? That business account? It's okay. Yeah, Disha. Good afternoon. Yes. So I think. So let us go further now. When to give China Ars? That's a very very important indication. Okay. So when to give China Ars? If I ask you, anybody, when to give China Ars? China Ars 1M single dose in 1 hour cured the case. Can anybody tell me what is the importance of China Ars? Anybody? Be fast so that we are very we can discuss more remedies regarding fever and this type of cases. I'm just telling you clinical cases. China Ars, medico joint, yeah, fever with severe prostration. So how will you differentiate China Ars, arsenic, muriatic acid, acid phos? All remedies have this prostration. If you have, I'll just tell you about China Ars. Go home and read, open Boric Mater Medica, China Ars. It is written, prescribe it homeopathically as a general tonic. as a general tonic with marked beneficial and prompt effect. These are the lines that you should remember of China horse. Imagine a patient that is so prostrated, cannot talk, cannot work, just keeps sleeping. In Sora, the patient is basically a diligent patient. So, whenever you require that tonic effect, think of China horse. One thing more in China horse, the patient has a very tired feeling, very tired feeling, especially in the head, and fever is continuous with weakness. Remember this symptom in China hours, fever is continuous with weakness. Remember this, underlying this, a continuous fever. Normally when the fever does not get down in one day, we give crocin, it comes down, again goes back. That's why we miss China hours. So continuous fever, don't give crocin if it is very high. With weakness, a tonic effect you want, it will act fantastically. And in China hours, there is sleeplessness due to nervous cause. Sleeplessness due to nervous cause. Few symptoms of China hours that you should remember. Welcome Medico, welcome Mithali, Mohammad Yassin, Safa Clinic. Yeah. Heat from stomach goes to head with sweating, is panicky, patient is thirstless, patient remains alright all the night. On waking, she becomes panicky, restless, more in and out. Now see, whenever the patient comes and tells you there is heat in the stomach, as such we have symptom, but it has no correlation with the heat of the stomach. Patient is panicky in the morning when the patient gets up. So this is again a very important symptom, restlessness. And how, when is the patient restlessness? That is more important. In morning, as you say, whenever a patient comes to you and the patient says he is very much panicky when he gets up in the morning, and classically you have defined symptoms very particularly, the patient is thirstless. 3-4 remedies that come to my mind. Of course, yeah, Dr. Vishaka, good afternoon. You must think about gelsemium, think about lycopodium, think about elianthus. But according to my experience, that heat of the stomach, the panickiness, the restlessness, morning, I would first prescribe pulsatilla. Pulsatilla, according to my experience, pulsatilla, acid first, and then you can go to gelsemium and lycopodium also. I found gelsemium also is very panicky, is very restless, is very anxious whenever he gets up, wakes up in the morning. And of course, gelsemium is a thirstless remedy. Okay, so I hope, Dr. Yasin, you got the case very well. As you go further, you can have gelsemium, and gelsemium has very interesting use. Aggravation, damp weather. Okay, so you must think about gelsemium, lycopodium, and nitric acid. Gelsemium, lycopodium, and nitric acid. Patient ages 28 years, Parkinson's since past 2 years. Father also suffering for Parkinson's, has tubercular heritage, suffers from frequent mouth ulcers, gave tuberculinum. No, lysine you can't think about, Dr. Yasin. Lysine does not come in this thing. Either at the most you can think about, you can go one step further and think about elianthus, but not lysine. Given tuberculum followed by Moxol, no improvement. Yeah, so best videos, as the name suggests. Whenever there is a case of Parkinson in young persons, so you must think there is a degeneration. Now, how is the degeneration and why did the degeneration occur? You must probe that part in your case taking. First of all, young age, 28 years of age, so career oriented thing is very also important in this case. Career oriented. First, problems in the career or challenge in the career, problem with the finance, challenge with the finance. In these conditions, you have to enter the case in these cases. Of course, we have told that it is a hereditary history of Parkinson. You can have hereditary of Parkinson now. If you find that the hereditary of Parkinson is there, destruction of the neurons, dopamine. So I would prefer, if this case comes to me, instead of tuberculinum, just, my friend, think about syphilinum. Syphilinum sometimes is very useful when there is a syphilitic history In the family Parkinson's, I also had a case of Parkinson's. I started with syphilinum. The patient, though is not cured, but it is much better, can do his daily routine. Of course, there is a bit trembling, but he is much better with our medicines. So you can think of starting with syphilinum. Yeah, Dr. Megha, welcome. Dr. Kurane. Okay, so I hope this is clear. Best videos. You can always type your names, so that we can know exactly with whom I am speaking to, and frequent mouth ulcers. So this is the classical psoriasis case, and because your family history is very strong, you can think about syphilis. I hope you got something entry point, and do ask the patient regarding finance, career, ambition, because or marriage life, because at this age these are the most improbable entry points where the patient suffers from a trauma, and because there is a hereditary miasm, Parkinson is there, he has developed Parkinson disease. If there is hereditary history of diabetes, he may develop diabetes. If there is hereditary of blood pressure, we can develop blood pressure. Depending upon your hereditary history, you will get that disease if the body or mind is thrown to a challenge. I hope you are clear with this best videos. Can we go further? If you have questions, keep asking it fast so that we don't waste time, scrolling up. Just Jalsi ma'am, I was. So nowadays disease is very common in our area. Complaints of vomiting, jaundice, pain in liver, and stomach pit. Patient can't eat or drink as it cause vomiting, tongue coated white. Yes. So where do you live, Dr. Yasin? Which area? Which area you're talking about? So now what happens, if you have a very prejudiced mind that Pakistan. So in I don't know which area, maybe that's a marshy area or a area basically where there's a lot of epidemic or sporadic disease coming on. But we also have a lot of cases where there is stomach flu is there, as they say. Now, whenever you have these type of symptom like vomiting and white coated tongue, most of the time symptomatically what happens, we try to first give antium and when antium fails, then we think of something else. But I also have a lot of cases. I have got very good results. You can write down the name of the remedies. First is iris versicularis. Second, ipecac. Third, of course, antium crude is there. Fourth, argentum nitricum, bryonia, and then China. These 6 to 7 remedies have given me very good results. Of course, the symptoms should correspond. That is very important. For example, if you have ever seen iris versicularis, a very very interesting remedy, and a lot of good results I have got with iris versicularis. But I'll just describe iris vers one symptom, then we can go ahead. In iris ver, one symptom is very important. There is burning of the whole alimentary canal. There is burning of the whole alimentary canal, and vomiting is sour and biliary vomiting. Patient comes and tells you there is vomiting, there is greenish type of vomiting with bitterness of the mouth, and that bitterness stays for a long time. Bilious vomiting and nausea. One more thing you must remember about iris versicularis, which normally sometimes is confused with Merck or Ipecac. Of course, those remedies have that symptom, but iris ver also has that symptom, that is profuse flow of saliva. जब भी हम बोलते हैं कि मुंह से बहुत थूक निकल रहा है, वी नॉर्मली थिंक अबाउट मक्सोल इपिकैक, और वो गलत नहीं है. मक्सोल इपिकैक में अंदर भी सलाइवेशंस है, बट आइरिस वर्सिकुलरिस के अंदर भी ये सिम्टम है. सो प्रोफ्यूज फ्लो ऑफ सलाइवा, एंड यू स्पेसिफिकली टोल्ड लिवर problem, pain in the liver region. Iris versicularis has pain in the liver, and the liver is sore. There is cutting pain in the region of liver, and then the patient suffers from diarrhea with burning in the anus. That is, and stools are watery. That is a complete picture of iris versicularis, which you will see a lot in this type of season, with the rainy season, and there is a lot of stomach infection. So iris versicularis in relation to stomach, abdomen, liver, and the flow of saliva All symptoms basically point out to iris versicularis. I hope it is clear, Dr. Yasin. Of course, you can go and read other remedies which I told you, like I told you something about Ipecac, I told you something about China, I told you about Bryonia, and crude is there. But do read these type of remedies. Of course, don't forget pulsatilla also. Okay, last time we had detailed pulsatilla symptom in relation to nose, and I hope you all remember that pulsatilla nose symptom. Okay. Hello, Dr. Babel. You are about 15 minutes late, Dr. Babel. Let us go further, and if there are no other questions, I could still say some stomach symptoms of pulsatilla. But pulsatilla is such a beautiful, well-read remedy. Everybody can pitch in some symptoms of pulsatilla. Anybody? Some symptoms of pulsatilla are very, very important in relation to stomach. Last time we did this relation to nose symptoms. What is pulsatilla in relation to stomach symptom? Yeah, Dr. Babu, that's okay. I was just euphoria, amygdala. Yeah. See, this is again a very, very rare remedy. But in which context you want to know something about euphoria? Anybody? Dr. Yasin? In which context? Of course, a very, very interesting, a very, very rare remedy. And I'm surprised that you want something about this remedy. Anybody? Any symptoms of euphoria? We have learned Asaram Yoga before BM, but anything you would like to share, with this remedy? I think now I have told you this type of remedies. This type of remedies are very common. Pain in elbow. Yes, very nice. Any other symptom you remember? Yeah, rectal prolapse. Any other symptom? So you must think about this remedy when it comes to, I'll tell something about gastric disorders. There is a lot of distension and bloating, and there is a lot of gas. And then like lycopodium, the patient wants to loosen the clothing, loosen the belt. That is important. Of course, what you told about pain in elbow is all are there in that remedy. Okay? So, any other thing? See, this is again, I would tell you, of course, we can give lot of symptoms of this, but then if you want to know only a classical symptom of this remedy which I have used, of course, I told you tightness of the abdomen, and one symptom of euphoria is that there is tightness in the region of spleen. So whenever the patient comes and tells you that the abdomen feels very tight, ask the area, and if the patient specifically tells about spleen, think about that remedy: stitches in the spleen, tightness in the region of spleen, and then you have some symptoms of euphoria in relation to other symptoms like irritation, burning of the intestinal tract, there is vomiting, there is diarrhea. These symptoms are there of this remedy, but I have basically not prescribed so much in stomach disorders. Of course, nausea is there, moving indoors, emulation by sitting still, emulation by supper. These all symptoms are there. But basically, if you tell me euphoria, I would take the tightness, the bloating, especially in the region of spleen. That's what I have seen in my case. Rectal prolapse, I have never given euphoria this remedy. Theoretically speaking, it is there, but I have never used in that complaint, Dr. Yasin. In Instagram, there are a few questions. They might have scrolled up. As you go further, we have done what do you call? Any other complaints? Any other remedies which you want to know? Yeah, something about pulsatilla I would like to share. We told something about pulsatilla, In pulsatilla, one or two symptoms are very, very important in stomach complaints. A pulsatilla remedy must have thirstlessness in nearly all complaints. Very, very important, thirstlessness in nearly all complaints. First. Second, there is a lot of dyspepsia with great tightness after a meal. Again, has to loosen up the clothing like lycopodium. And that's why These remedies are so close, lycopodium and pulsatilla and these remedies, because the patient has to loosen the clothing, and vomiting of food eaten long before the patient says, I have eaten breakfast, I am now feeling much better. But at 12 o'clock, she says that I have vomited everything what I have eaten in breakfast. And this is a very, very important symptom of pulsatilla. Vomiting of food eaten long before. Remember, my dear friend, this symptom of pulsatilla. Vomiting of food eaten long before. We have lots of remedy when the patient says, I eat my food, I have vomiting, in 10 minutes I have vomiting, in half an hour I have vomiting, but the patient says long after eating food there is vomit. Think about pulsatilla. So if you don't have any questions, can we go further? Anybody? Saying something about sanguinary stomach. See, these remedies are of course very, very important, but I would just share my experience, Dr. Yasin, because this is all clinical, and basically I believe in a lot of clinical applications. If you open your materia medica, you may have a lot of symptoms of sanguinary. First of all, tell me, what is your idea about sanguinary stomach? Tell me, anybody. Sanguinary stomach, again, a very, very interesting remedy. Of course, it has some symptoms which are very, very peculiar about sanguinary. Can anybody tell me something about sanguinary? Anybody? Dr. Yasin, anybody? Any symptom which you feel are very, very important if you have seen in your practice? See, burning and drawing pain in stomach. Now see, whenever the patient complains about drawing pain, it is very difficult to understand what is the meaning of drawing pain. So that's why we normally fail to understand this symptom. Anything else? Anything else? Sanguinary canadensis. Tell me some clinical symptom, drawing pain. These pains are very good to write and score marks, but sometimes drawing pain the patient is not able to understand, So remember, in stomach symptom of sanguinary there is unquenchable thirst. Cough, better irritations. Yes. Now we are telling. I am telling only symptom regarding to stomach. Unquenchable thirst. The patient keeps on drinking water, gets a bottle also in the clinic and keeps on drinking and telling symptoms. That is unquenchable thirst. Second symptom, my dear friends, please write down, Dr. Yasin. Nausea with salivation. This is the symptom which I have always seen and prescribed in cases of sanguinary, that is nausea with salivation. Of course, the patient has sinking, faint, all one sensation in stomach, but this is a very important symptom of sanguinary, that is nausea with salivation and the patient has unquenchable thirst. So these 3-4 symptoms very, very important. Again, the same patient of sanguinary has pain in the region of liver and the stools are gushing. And if I am not mistaken, sanguinary canadensis is a very, very important remedy for cancer of rectum like ruta. So whenever you are thinking about cancer of rectum and ruta, do study also sanguinary canadensis from the materia medica. I hope this is clear. Yakov beta practitioners. Male 31, patient of fibrocystic type rheumatism, diagnosed as non-inflammatory, but patient has stiffness and couldn't walk. Whenever you are using the word fibrositis, types of rheumatism, non-inflammatory, but patient has stiffness. Now, whenever there is stiffness, and the patient cannot walk. Yeah, thank you, Dr. Yasin. So, whenever the patient has stiffness, and if only Dr. Yasin is understood or everybody is understood something about sanguinary, and if you have understood, do try to give me thumbs up, so that I also know that these rare remedies, basically, I also only remember few symptoms of the remedies. So I know that you have understood and got some idea about the remedies. Whenever you are Dr. Asan, choice of remedies. See, whenever it is non-inflammatory, that means the patient is in a stage of psychosyphilitic stage. Now understand, how did the miasm travel from psora to psychosis to syphilis? In these type of cases, of course, the remedy basically, if you are talking symptomatically, would not work. That means you must think about causticum, you must think about rustox, you must think about Lathyrus sativa, you must think about guaiacum, you must think about macphos, you must think about calcarea carp. These are classical psychosyphilitic remedies that you should think about. But do think in this case, Dr. Arsen, that why did the patient land up into a psychosyphilitic case? It is important to understand the travel of disease, especially from the mind and then to the body. In these type of rheumatic cases, you must understand it's an autoimmune disorder and make sure that you understand why is the patient having this type of symptom, because the patient, there are thoughts in the patient which is killing himself, and that's why the patient suffers from these type of complaints. Whole body muscles and joint stiffia. So whatever remedies I have told you, this includes these type of remedies. See, I can also give you very rare remedies related to stiffness, but I basically believe when there is stiffness, and it is non-inflammatory, think about some polycrest. Otherwise, I could have told you we have remedies like strychnine, we have remedies like Nux, we have remedies like lachesis or mercury. These are also very important indicated remedy. But what remedies which I have told you, 6 and 7 remedies, those are very commonly indicated in these type of complaints. And autoimmune disorders, case taking is very important rather than just treating the patient symptomatically. Okay, did you get some idea about that, Dr. Hassan? So I've got one thumbs up from Dr. Yasin. I think she only understood about sanguinaria. It's a wonderful remedy. Do make sure that you understand this remedy and try to give this, especially think about sometimes cancer of rectum also, Yeah, thanks, Dr. Yasin. Okay, one or two I think have scrolled up on Instagram. Instagram, the activity is very less today. Otherwise, Instagram is very fast in asking questions. Today YouTube is, I think, doing better. So we can continue in any questions, or before that I will talk something about some other remedies also. See, basically this is a season where, it is called as a doctor's season, patient eats outside food and gets fever and diarrhea and dysentery and all, GERD. So I'll just finish one of the remedies, and then we'll go for GERD. A important remedy that you think about in this type of weather or season is that Ipecac, which I told you. Ipecac, always remember, tongue is usually clean. The mouth is moist with much saliva. Now, I have told you something about saliva, 2 or 3 Muxol, Ipecac, Kali iode. So these are the upulcitic. These are the remedies you should think about salivation, because otherwise, you are fixed. In Ipecac, constant nausea and vomiting. Very important. Constant nausea and vomiting. One thing is important in Ipecac, my dear friends. Write down, I just cured 3 or 4 cases of Ipecac. The body feels rigid and stretched out stiff. There is stretching and there is a lot of stiffness in the body, and that is the main important symptom. I took 3 or 4 cases, got the same symptoms. I prescribed Ipecac, of course, confirmed with few symptoms also, and I cured the case. GERD, gastrointestinal reflux disease. Whenever you are treating GERD, make sure you take symptoms in relation to how was the eating habits of the patient before he developed the symptoms. I had found in a lot of cases the patient's eating habits are not on time. Every day the time is different. He is drinking a lot of tea, taking coffee, eating a lot of snacks. Sleeping time is not good. The life is all total chaotic in relation to food, because of which the body has to continuously adjust the mechanism of digestion. Of course, the patient might be busy in his work and all, but he is doing this type of complaints. That's why these are the remedies you should think about. That's why the first remedy that everybody should think about is Nux. And then you have remedies like, simple when you are eating and not eating is chaotic, your sleeping is chaotic. Think about Cocculus indicus, think about Nux, think about Staphylococcus aureus, think about indigo, think about natrimure, or think about Lycopodium china and carboage also. So these are the remedies that you should think about in cases of GERD. Dr. Ashwin, yeah, welcome. I hope you got some ideas. You must understand why there are a lot of patients who come to the clinic and say, Doctor Sir, I don't eat anything. I don't eat non-veg. I only eat green sabji and two chapatis. That is also jawari. But still I have GERD. Still I have acidity. So how can you have that type of complaints? Go into SORA. Understand what was the patient in SORA, and then you are able to prescribe these remedies or understand the case very beautifully. Okay, I think all the questions are done, and oh, it's already half an hour. So everybody, thank you for joining, and I hope you enjoyed as much as I enjoyed teaching you and sharing my knowledge with you. Thank you so much.